Hello, my name is Claire Brown and I'm a women's and men's health physiotherapist. This is part 2 of our pelvic girdle pain class, pelvic girdle pain in pregnancy. On the list of resources on this website you should see a link to our pelvic floor muscle exercise video. Do please click on that and have a look at that. Penny will talk through how to do your pelvic floor exercises, which is very important in pregnancy and managing the pelvic girdle pain. Start these now if you haven't done already, and they should be part of your life forever to manage any bladder, bowel, prolapse and help improve your sexual symptoms as well. So we're now going to talk through some exercises to help with pelvic girdle pain. Try these at home. If you find that any of these make your pain worse, then please stop and try the other exercises in the video. So we're now going to get Kate to come and be our model today. First exercise we want you to practice is a lower tummy exercise. This is working your transverse abdominis muscle. This is often the muscle that we often describe as giving your baby a hug. So we want you to practice contracting this. You may find it easy to place your hands on your tummy, and what I want you to do is take a deep breath in, and on your breath out, pull the lower part of your tummy in. You should feel your muscles contracting underneath your hand and around your baby. Try and breathe normally when you are squeezing this muscle, and hold perhaps up to 30 seconds at a time, and then relax. The next exercise we're going to show you is a lovely stretch for your back muscles. If I get you to stand up, Kate, and turn around. So your lumbar lordosis here is often increased in pregnancy, and it's these back muscles here that we are going to get Kate to stretch. So the easiest way to do this is if Kate leans against the wall, have your feet slightly apart and away from the wall, lean against the wall, bring your arms up either side of you, tilt your pelvis back, and then I want you to slide the upper part of your body down one side, keeping your shoulders and your elbows back against the wall, and you should feel a stretch down one side of your body. Hold it there for up to 10 seconds and then come back up again. Good. Repeat one side, perhaps up to 10 times, and then make sure that you repeat the opposite side as well. Lovely. And Kate should be feeling a nice stretch on her back down this side. Lovely. We're next going to talk you through a pelvic tilt. So, this is an exercise that you can do many times throughout the day in different positions. So if Kate turns around and puts her hand on the wall, so make sure the wall is taking most of your weight. You have, again, your lumbar lordosis here, and you're trying to get rid of this. So I'm going to get Kate to tuck her bottom underneath her, and then relax. So the movement just comes from your pelvis, and you're just tucking the bottom underneath you and then relaxing again. And again, do this up to 10 times in this position. You'll probably feel your bump come up to meet you just underneath your bra level. You can also do this exercise in sitting. So get Kate to sit down in the chair. You probably need your bottom away from the back of the chair so you've got a bit of space behind you. Sit up nice and tall, and then imagine that you're slumping down. Imagine that you're sitting on the base of your spine so that you, again, tilt your pelvis underneath you. And then sit up nice and tall again. So again, it's just this part of the body that's moving. Kate is rocking down. Good. And then coming back up again. Good. And again, repeat up to 10 times regularly throughout the day. Now, many people have a gym ball. You can also do this exercise on one of these. So Kate is going to sit down on a ball. Make sure you have your feet slightly away from the base of the ball so that you feel nice and stable. Feet slightly apart, sitting up nice and tall. And then Kate again is going to rock down onto her pelvis and then come back up again. Use the ball to very gently roll the ball underneath you and then back up again. Good. In this position, you can also do a few other exercises. So Kate can go from side to side. Lovely. And then she can also circle her hips in both directions, clockwise and anti-clockwise. Lovely, thank you, Kate. Next, we're going to show you an exercise that we call the clam. So find a comfy position on the floor or the bed. Kate is going to lie down on her side. Now again, try this exercise at home. It should be comfortable. If you find that it makes your pain worse, then please stop. So Kate is going to lie down perfectly as she is at the moment. She's going to keep her hips over one another here. It's called the clam because it looks like a clam shell is opening. So Kate is going to very slowly lift up that top knee, and she's going to create a space between her bottom knee, and then she's going to slowly lower it back down again. So the exercise should be done slowly. Kate shouldn't tilt or twist over. So we want to make sure the hips are over one another. So make sure that no rolling over like this is happening. Your hips should stay pointing forward, and it's just that knee coming up. Keep your feet touching each other. That's lovely. And again, repeat up to 10 times. And make sure that you repeat it both sides. Now from this position, you can do a lovely exercise called a cat arch. So if Kate gets onto her hands and knees, you might find this is a very good birthing position as well. Have knees slightly separated. She starts with a nice flat back, and then she's going to arch her back by tucking her bottom underneath her, tucking her head underneath her also, and you can see she's got a lovely arch there. She's got a nice stretch. And again, you can hold that up to 30 seconds. To progress the exercise, if Kate separates her knees a bit more so she's got room for bump, then she can go back and sit down on her heels and get even more of a stretch in her back. You can even stretch your arms forward a little bit more and lower your head to get more stretch. And again, you can hold that up to 30 seconds. Lovely, thank you, Kate. If you come back up again. So we're now going to show you a bottom squeeze. This is really important for strengthening the muscles around the pelvis, and you can do this in various positions. So an easy position is if I get you to stand up, Kate, with one leg in front of the other. I'm going to get you just to turn to the side. That's it. So Kate's going to put one leg in front of the other, and the bottom cheek that she leaves behind, she's going to squeeze as she lunges forward her weight. If you're not sure you're doing it right, just rest your hand on your bottom so that you can feel that that muscle is squeezing. And all Kate's doing is transferring her weight and squeezing the muscle that she's left behind. So you can do this when you're waiting for the kettle to boil, you've got something on the stove cooking, whenever that you find you just stood, you could be doing some exercise. And make sure that you just switch to the other side as well. This exercise can also be done from sit to stand, which is excellent because you can just add it into your daily routine. So Kate's going to have a sit down there for me. She puts one leg in front of the other. She can stand up, and the bottom cheek that she leaves behind, she's just going to squeeze. Again. It's just sit to stand and squeezing the bottom cheek that she's left behind. So try and build this into your daily routine in little odd scenarios that you find that you're doing anyway, so these don't become a chore.